Do you wake up with neck pain in the morning and maybe you're wondering what is causing that neck pain? Or maybe you have this shoulder tension that you didn't go to bed with, or worse yet, maybe you wake up in the middle of the night because your hands are numb and tingly and you don't know what's causing this, and more importantly, what it is you can do about it. Well, that's what we're going to discuss today, is what is causing that problem and what you can do about it. The top 5 tips that we recommend so you wake up pain-free. And bonus feature, we will discuss what you can do if you find yourself waking up with neck pain and you need some tips to implement right now. Many people have been complaining, especially recently, that they wake up and they have neck pain, they have shoulder tension, maybe even are a little foggy headed, maybe even have a light headache when they get up in the morning. And we've also had an increase in the number of people who are waking up in the middle of the night because there's numbness and tingling in their hands. So I wanted to explain what's causing all of this and, more importantly, what you can do about it. If you're waking up with neck pain, it's because your neck is not in the correct position while you're sleeping. So it is getting aggravated and you're in that position for hopefully a long period of time, because hopefully you're getting a good night's sleep, which can cause you to wake up feeling foggy headed. It can cause headaches or just kind of a general malaise when you first wake up in the morning, which is not what you want after you've gotten a good night of sleep. The other thing that can happen is that your shoulders can end up in the wrong position and put increased stress on the nerves that go from the neck down into the hand. So the nerves in the hand actually start up here in the neck, and they travel through these muscles here as well as the front of your shoulder. And if everything's in a weird position while you're sleeping, that can definitely put a lot of tension or a lot of compression on those nerves and cause you to wake up with your hands numb or tingly. The other cause of this can be if you sleep with fisted hands. And sometimes people may not fall asleep with fisted hands, but you may find that you wake up like that. So these tips will help you if you fall asleep with fisted hands as well, and if you wake up in the middle of the night with numbness and tingling. The first thing I recommend you do if you find yourself waking up with pain in your neck in the morning and it's happening multiple mornings in a row, is change the habits before you go to sleep. The first thing I want you to do is do some deep breathing before you fall asleep. It does not have to be a whole bunch of deep breathing, but as soon as you lay down in bed, I recommend starting off on your back to do the deep breathing. Do some of that deep belly breathing, which will help to decrease some of the stress and anxiety that's being carried in your shoulders. It will also help to activate your vagus nerve, which is your feel-good nerve, and it gets all the organs in your body moving and working correctly, which is great right before you go to sleep, because then everybody just calms down so you can actually relax. To do the deep breathing, we'll link a video where we discuss it more here, but the concept is to do that deep belly breathing. So you want to make sure that you're moving your belly, making a big belly bubble, and then letting it all come back down so that you're not using the muscles up here in your neck and shoulders. These muscles are called your accessory muscles of respiration, and they're supposed to be used in a fight or flight situation, which is, I need to run away from a bear or a moose or something like that. That's when we're supposed to use these muscles. However, in today's society, we tend to use them too regularly and they get overstressed and tired. If we're also stressed or have anxiety because of other things that are going on in our life, it tends to come out when we're sleeping and we kind of droop up here, which makes everything really, really tight and painful then when we wake up in the morning. So the first thing I want you to do is, as soon as you get into bed, lay on your back, do 10 to 15 belly breaths. It shouldn't take more than a couple of minutes, and get your body to calm down, activate that vagus nerve, and get everything relaxed so that you can have a good night's sleep. The next thing I want you to focus on is making sure that you have the correct pillow. Now, what is the correct pillow? It is different for everybody, friends, and I will tell you I've recommended many, many different pillows to many, many different people over the time. What I can tell you is that you want to make sure that your head and neck are properly supported. So if you lay on your back, you probably need a very thin pillow but you may want to roll up a towel roll and put it underneath your neck so that your neck is also supported. Because if you just have a thin pillow, then your neck's kind of left hanging out there. That space isn't filled in. The same thing can happen if you're a side sleeper. So if you're sleeping on your side, you want to make sure you fill in this hole here, that is your shoulder, but also the one that's in your neck. So you want to make sure that you have a good pillow that's going to fill in this hole as well as this one. So we have some pillow reviews which we'll link here, which kind of discuss the different types of pillows and who I recommend them for and who they probably won't work very well for. I definitely recommend trying it out. It is worth the time and investment to find a good pillow to make sure that your neck does not hurt when you get up in the morning. Another thing you want to do, especially if you have numbness and tingling in your hands when you wake up in the morning, is you want to make sure that your shoulders are properly supported. So if you're a side sleeper, you can either hug a pillow in front of you, or you can have a pillow down at your side if you sleep with your arm down at your side. This will help to keep that shoulder nice and open so those nerves that are in that shoulder will not get compressed and decrease your risk of numbness and tingling in your hands. If you're a back sleeper, I have found a lot of patients really enjoy having a small pillow underneath each arm, supporting each arm so that they're not stuck down. Because a lot of us have a lot of tightness in our pecs and these muscles up in here. So if your arms are down, your shoulders end up being up. So if you have a small pillow, it doesn't have to be even a regular size pillow, but a small pillow that helps support your arms, it will help to decrease that tension through the pecs while you're sleeping. The next tip is for my stomach sleepers. If you tend to sleep on your stomach, I want you to make an active effort to eliminate that pattern now. It is really challenging to your neck, to the joints, to the muscles, the ligaments, the tendons, everything, because again, you're in that position for a long period of time. So if you're turning and looking over to one side, because obviously if you're sleeping on your stomach, you can't have your head in the pillow, makes it very difficult to breathe, then you're getting a lot of stretch on this side as well as compression on the other side. Now, it would be an ideal world if you could switch your head from side to side every 15 minutes or so, but one, you wouldn't get a very good night's sleep if you were doing that, and two, that's just not a reasonable option. So it's best if you can find a way to start eliminating that pattern now. One of the things that I recommend for my patients is that they use the pillow that I discussed earlier. So either one in front of your belly if you're trying to transition to side sleeping, or one underneath each arm if you're trying to transition to back sleeping, so that your arms feel really well supported. They also serve as a block, so if you try to roll over onto your stomach in the middle of the night, it's going to be really, really difficult. So it's a twofer. The last thing that I recommend if you're tending to wake up with a lot of neck tension is to take any electronics, especially any that make noise, out of your bedroom at night. So if we're getting that input during the night of notifications or different sounds or something like that, that tends to activate our brain and make us think, oh, you know, what's going on? It can be really difficult to get good quality night's sleep, especially if you're really attached to your phone the whole time. I've found a lot of success for people if they leave their phone outside of their bedroom, and then that way they have a chance to wake up, to go about their daily routine before they look at their phone. So I would recommend having your phone somewhere other than your bedroom to help you get a better night's sleep, decrease your anxiety and your neck tension, which will decrease your pain overall. Now, what do you do if you do wake up with neck tension? And sometimes it's gonna happen. I get it. Life is life. And sometimes you just wake up and you didn't sleep as well or as long as you would have liked, or maybe you're a little dehydrated or something else is going on and you just feel like you have a lot of neck tension and you're wondering what you can do in those situations. I've got two of my favorite stretches that I recommend you do as soon as you wake up if you're feeling that neck tension, or if you take a shower pretty early in the morning, like pretty soon after you get up. These can be great stretches to do in the shower too. So the first stretch we're going to do is called a cervical rotation. So when you're doing this, you want to make sure you're either sitting up straight or standing up straight if you're in the shower. If you're in the shower, I definitely recommend having your back to the hot water so you've got that nice hot water beating down on your shoulders and neck. That can help relax things a little bit. You're going to turn and look over your shoulder as far as you can, and then slowly turn and look over the other side as far as you can. While you're doing this, what you want to be doing is just going as far as you can pain-free until you feel a light stretch, but not pushing into any pain areas. You're going to do 20 reps nice and slow to make sure that you're getting a really good stretch on both sides. Now the next one I recommend you do is actually to help get more of that rotation in your neck. You're going to take your hand and you're going to make a collar behind your neck. Now you're going to use your elbow to help guide that motion and go as far as you can to one side. Now this one you could only do one side at a time because it's only going to allow you to, like, trying to go to the other side is not going to work right. So you're only going to be able to go to one side at a time. But this collar is going to allow more of that motion to go down into the upper back and move those vertebrae, or the parts of your spine, that are getting sticky. So getting those moving, this rotation actively does more of the upper neck. If you collar up, that decreases the amount of upper neck motion and increases more of the lower neck and the thoracic spine. Now, if you're doing this rotation stretch and you're not in the shower, what you can do is you can get a towel, so just a regular hand towel, grab it at the corners, and then you're going to put it kind of on your mid-neck area. Now you do want to be careful with this one because you want to make sure you're not pulling your neck forward. That's not a good thing. So we're going to do a little bit of a chin tuck, just trying to tuck your chin back a little bit, and then you're going to rest these down. Chin tucked. Now hand is going to come grab the bottom corner. Other hand is going to grab the bottom corner. And then you're going to use this to help you get that rotation. So this should feel really good. It should help you get a little bit more motion, but also get more of that stretch. Remember to keep your chin tucked while you're doing it so it doesn't pull your head forward. To do the other side, we're going to have the bottom hand here, top hand here, which is the one that's guiding that motion. Again, when you're doing this one, I recommend 20 reps to each side, but you can only do one side at a time. So those are our top tips to eliminate pain while you're sleeping. And if you do wake up with pain, we've got some bonus tips of things you can do to help get your neck moving better, which will help to improve the blood flow and decrease your pain. If this video was helpful, definitely drop us a comment below, click that like button, and we'll see you in the next video.